There are many kinds of intellectual disabilities, but in this video, I will focus on cerebral palsy and trisomy 21, or also known as Down syndrome. So, what is intellectual disability? Intellectual disability, or ID, is a term used when a person has certain limitations in cognitive functioning and skills, including communication, social, and self-care skills. Now, let's talk about cerebral palsy. Cerebral palsy caused by abnormal brain development or damage to the developing brain that affect a person's ability to control his or her muscle. Cerebral palsy is caused by damage or abnormal development in the parts of the brain that control movement. The majority of children with cerebral palsy were born in a situation called congenital cerebral palsy. And the causes of cerebral palsy that occur before birth include damage to the white matter of the brain, abnormal brain development, bleeding in the brain, lack of oxygen in the brain. A small number of children have what we call acquired cerebral palsy, which means the disorder begins more than 28 days after birth. And some causes of acquired cerebral palsy may include brain damage in a few months of years of life, head injury from a car accident, a fall, or child abuse. Cerebral palsy treatment can vary for each patient depending on the type and severity of symptoms. Cerebral palsy is a non-progressive disorder and does not worsen over time. Getting proper treatment for cerebral palsy symptoms can greatly improve your child's condition. Now, let's proceed to trisomy 21, or also known as Down syndrome. Down syndrome is a condition in which a person has an extra chromosome. Chromosomes are small packages of genes in the body. They determine how a baby's body forms and functions as it grows during pregnancy and after birth. Typically, a baby is born with 46 chromosomes. Babies with Down syndrome have an extra copy of one of these chromosomes, which is the chromosome 21. A medical term for having an extra copy of chromosome is trisomy, and Down syndrome is also referred to as trisomy 21. What causes trisomy 21? The extra chromosome 21 leads to the physical features and developmental challenges that can occur among people with Down syndrome. So, what are the common treatments for Down syndrome? Treatments are based on each individual's physical and intellectual needs, as well as his or her personal strengths and limitations. People with Down syndrome can receive proper care while living at home and in the community.